Let's begin our section 1 of the lecture topic, foreign bodies of the food passage. And in this section, we will talk about the ingested foreign body. When we will talk about the ingested foreign body in the first section, we will mainly talk about the ingested foreign body which are lodged in the sites including tonsil, base of the tongue or vallecula, posterior pharyngeal wall, pyriform fossa, and what are the causes, what's the etiology of these ingested foreign body, how they get ingested, and what are the effects and features that can lead to the ingestion of these foreign bodies. So ingested foreign body may lodge in, so different sites at which these ingested foreign bodies get lodged or they block that site. The features that the patient will present will depending on that site of the lodgement of the foreign body. So they may lodge in the tonsil. The foreign body get lodged in the tonsil, base of the tongue or vallecula, posterior pharyngeal wall, pyriform fossa. So these are some common sites where these ingested foreign bodies can get lodged and cause the features or presenting complications depending on the site of the lodgement. And also esophagus. So all these are the different common sites of the lodgement of the foreign body. We have the tonsil. Tonsils are in the neck. They are the lymphoid tissues present in the neck. So it's the tonsil, base of the tongue or vallecula, posterior pharyngeal wall while eating or swallowing. Sometimes the sharp objects like the fish bone get very easily stuck in the posterior pharyngeal wall. So these are pyriform fossa and then the esophagus. All these are the sites where the foreign body can get impacted or lodged. First, the tonsil. Here you can see these are the tonsils, and that's the foreign body that gets lodged in the tonsil. Usually sharp fish bone or a needle in one of the tonsillar crypts. So one of the tonsillar crypts, sharp object like fish bone or needle. A lot of people when they work with the needle, they hold that needle in the between the lips. Sometimes accidentally it gets ingested and get lodged in the tonsillar crypt. So that's the common objects that get lodged in the tonsil. Here that's the sharp object, needle or fish bone. Can be easily observed by oropharyngeal examination. So by oropharyngeal examination, usually all these ingested foreign bodies, if it's in the tonsil or if it's in the posterior pharyngeal wall and in the base of the tongue, usually they are very easily examined. A patient open the mouth and by the mirror when the doctor looks at the oral cavity, they can easily observe these foreign bodies. So by oropharyngeal examination, they can remove later on. Then base of the tongue or vallecula is the other site of lodgement of ingested foreign body. Usually again fish bone or needle. Observed by mirror examination. So as I mentioned, by the oral mirror examination, oropharyngeal examination, the patient opens the mouth, doctor by pressing the tongue, or if it's in the tongue, by elevation of the tongue to look at the foreign body in the base of the tongue or vallecula. It's very easily observed by the mirror examination. removed as office procedure. So it's just lying there right in front. So it's very easily removed in the office as outpatient. Asking patient to hold his tongue. Examiner holds large laryngeal mirror or endoscope in one hand. So they observe the large pharyngeal mirror in the hand and they can see the foreign body. Even if it's small, it is magnified by the mirror and they can easily examine the foreign body that is present in the base of the tongue or vallecula. Curved forceps in other hand held by the examiner. So in the one hand there is mirror, in the other hand there is the curved forceps, and the foreign body is very easily removed by the curved forceps by looking in the mirror. Sharp needle may get embedded into substance due to attempts to feel. Sometimes what happens, usually the patient, they try to remove the sharp object, and in the process of removing they can further push it down and it can get embedded into the substance deep. So in that case, usually the removal, it is diagnosed by radiology to look if there is any foreign body present in the substance. Pharyngotomy to extract it. Now the removal is little hard. Pharyngotomy is performed. The pharynx is open to remove that sharp object because now it is pushed further into the substance, into the pharynx in the process of trying to remove the foreign object. So that's the process of removing the object that's deep in the pharynx. In muscular layers, a chance to migrate, early removal is indicated. So if it is pushed further down, it is present in the substance, in the muscular layer, needs to be removed early because there are chances it can migrate further and go even deeper. And then the removal will be really more hard. So it's preferred that it should be removed early by performing pharyngotomy. So simple foreign bodies which are just observed on the mirror lying on top can be removed with the curved forceps, but sometimes in an attempt to remove the sharp object, because it's sharp pointed, it's easy for that object to go down and go into the deep substance, into the muscular layer. In that case, need to be removed by performing pharyngotomy. Posterior pharyngeal wall is the other site where the ingested foreign body can be lodged. A wire, a needle, or a staple can get transfixed to posterior pharyngeal wall. It happens when these objects are accidentally taken with food. So accidentally ingestion of these substances like needle, staple, sometimes these things, especially in the houses where there are small children, they usually play with these things and by accident they can put them in the food, and when that food is ingested, usually that staple or needle is ingested with the food, and because it's a sharp object it can get attached to the posterior pharyngeal wall and it gets stuck there. Seen with oropharyngeal examination, because posterior pharyngeal wall you can very easily see here. That's the procedure with the tongue down, but with the help of tongue depressor or the examiner just holding the tongue with the mirror on the eyes. Usually when they see, you can see the foreign body on the posterior pharyngeal wall very easily. So by oropharyngeal examination, under good illumination, removed with the forceps. So the posterior pharyngeal wall is within the reach. With the oropharyngeal examination, the foreign body is removed easily from the posterior pharyngeal wall with the help of the forceps. Pyriform fossa. Pyriform fossa is the other site where the ingested foreign body can get impacted. Fish bone, chicken or mutton bone, needle or a denture may lodge in pyriform fossa. Denture is another very common object of lodgement in the food passage, because lot of people who wear the dentures, who have dentures, they get removed and they can get swallowed and they get impacted. So fish bone, chicken, mutton bone, when people chew on these bones, they can easily get stuck. Small foreign bodies removed under local anesthetic. So if it's small, it is removed easily by the local anesthetic with curved forceps. If they are large, impacted foreign bodies or in children, because children are not very cooperative, they don't easily let the doctor access the oropharyngeal pathway. So these with the large object, and in children usually it is removed by endoscopy under general anesthesia. So in the pyriform fossa, usually it is removed in these, if it's small, by local anesthesia, but if it's large and in children, it is removed under general anesthesia. Now in esophagus is a tube, long tube that carries the food from the pharynx into the stomach. So it's the connection between the throat and the stomach. So esophagus is the common site of the lodgement of foreign body. Usual foreign bodies that get lodged in esophagus are the coin, piece of meat, big piece of meat if swallowed, chicken bone, denture, safety pin, or a marble. So pretty much these objects that are ingested or foreign objects are the same, mostly needle, chicken bone, fish bone, mutton bone, big piece of meat, dentures. These are the common objects which get lodged. But in esophagus, coin is also common, especially in children. You can see the x-ray with the round coin. Lodge below cricopharyngeal sphincter. If they lodge lower down, usually suspected different conditions like congenital or acquired stricture, malignancy in adults, and follow-up bariums follow when edema subsides. So impaction of the foreign object can be due to presence of strictures in esophagus, or if there is malignancy, mass present, usually then the passage is not clear and the objects get lodged easily. So we should pay attention if there is esophageal lodgement of foreign object. We should pay attention that there may be esophageal stricture which may be congenital or acquired, or there may be malignancy present. So we should rule out those conditions, and those can be done by the barium swallow, and then the picture is taken to look for any obstruction or stricture. Now the etiology of the impaction of or ingestion of the foreign objects in the food passage. Age is very important. As I mentioned before, the small children who play with small toys, or when they crawl on the floor, if they find something on the floor, they are curious about what this thing is, and they put it in the mouth. and swallow it. So age is very, very important. Children mainly affected for impaction or ingestion. Nearly 80% are below 5 years. At 5 years of age, usually they are that's the age at which they differentiate between very clearly whether we need to swallow it or not. But before 5 years, especially in the crawling age, less than 1 year or after between 1 to 2 years is very, very common age at which these things can happen. And then the education of parents is also very important in this respect. So they should know that we should not leave the children alone playing with the small toys or in the area where the things are present, where they can easily put in their mouth and they can choke on it. Then the carelessness is another etiological factor. Poorly prepared food, improper mastication, hasty eating and drinking. So all these are very, very important. Sometimes people, they don't chew the food very well, they don't masticate it very well, and when they swallow the food, they usually swallow the big meat or bone, they can swallow it and they can get choked on that object. Then also psychotics, if they are not mentally stable, these are the individual also who can easily get ingested the foreign body. So foreign body may be swallowed, attempt to commit suicide also. So these are some very important etiological factors or etiologies that can lead to ingestion of foreign objects. We need to be very, very careful in cooking our food, in handling the food, in cleaning the food. So it should be free of any object like staples or needles. And also we should be very, very careful in eating, and we should chew the food very well, so avoid the big bolus to ingest. So all these are etiological. Then the common sites, we said it's the tonsil, posterior pharyngeal wall, base of the tongue. All these are the sites where the foreign esophagus get impacted and cause different complications and side. Also, there is some other etiological factor, loss of protective mechanism. Loss of protective mechanism like upper denture prevents tactile sensation. So upper dentures, they prevent the tactile sensations. Then they usually don't have the sensation if they have anything like a bone, fish bone or objects like that that can easily get ingested and cause obstruction of the food passage. It can be missed and they can easily ingest those. Foreign bodies swallowed undetected, loss of consciousness, epileptic seizures, and also deep sleep or alcoholic intoxication. These are all the factors that can cause the ingestion of foreign objects. Narrowed esophageal lumen, as we mentioned already, as a result of these strictures, which can be congenital or acquired or malignancies. So food pieces held in esophageal strictures, which can be acquired or congenital. Pieces held in esophageal carcinoma. First symptom is usually sudden obstruction. Foreign body like piece of meat, fruit or vegetable. So if there is constriction or narrowing of esophageal opening, then the simple objects like fruit, vegetables, which usually do not cause obstruction of the food passage in the normal individuals, healthy individual, can get easily impacted in the esophagus. So that was all about the section 1. Thank you for watching sqadia.com.